A violent, paranoid schizophrenic armed with a knife and driven by voices in his head. Voices that drove Valdo Calocane to kill Grace O'Malley Kumar, Barnaby Webber and Ian Coates. Calocane was not engaging with his care or taking his medicine. There were so many red flags, so many warnings. But he was discharged to kill. A review into the failures in Calocane's care is damning.
The risk assessments in his case were really poor by treating consultants, and he was sectioned 4 times. There were 4 opportunities to change his medication, change it to depot medication, which is injectable, which means that the patient complies. There were no community treatment orders put in place so that he would take his medication in the community. We had a simple case of a culpable person who just did not take his medication. All of this is devastating to read. It was so basic. The errors were not technical. They were basic errors and repeated 4 times over.
The CPC report clearly also says that basically there was no doubt that Valdo Calocane was going to relapse given his non-compliance with his medication and lack of engagement. And ultimately, statistics show that if there's a decent or at least even a basic standard of delivery of care, homicide does not occur.
Some of these failings had already been laid bare by Calocane's brother in a letter sent to the victims' families. He wrote, "We have seen firsthand just how broken the mental health care system is and can say without hesitation that this tragedy was completely avoidable if the system worked properly. My mother regularly expressed concerns to the relevant services about Valdo's mental deterioration, but these were constantly played down because he looked okay. Of course, we knew this not to be true, as he would constantly speak of his paranoid delusions to us." But Ian Coates' family say Calocane's family should have done more.
Basically washing his hands of responsibility here. Him and his mother, they did what they could, but it was all down to the NHS. It was down to the mental health for not doing what they needed to do. But they knew he was unwell and they didn't do enough to help him.
The chief executive of Nottinghamshire Healthcare says he is committed to doing everything within his power to prevent such a tragedy reoccurring. But the families want and deserve more answers and full accountability. Ashish Joshi, Sky News.